Hello, you're listening to the latest season of the COVID Inquiry podcast. This week, Nicola is joined by Lorelei King, actor, screenwriter, narrator, and most pertinently, a member of the COVID-19 Bereaved Families for Justice group. Together, they're going to reflect on how the recent hearings went and look forward to the next few days of evidence. Please note, some listeners may find the contents of this podcast distressing.
Hello everyone, I'm Nicola Brook and I'm the solicitor at BJC running the work of our team on the COVID inquiry on behalf of COVID Bereaved Families for Justice UK. I'm here with my co-host Lorelei King, who is a member of the group having lost her husband to COVID. Joining us today to discuss the hearing in week 3 is Julia Jones, who is the co-founder of John's Campaign. They campaigned for a family carer to be not just allowed but welcomed into any setting where their loved one is receiving care, particularly if someone is living with dementia. Now, they principally campaign at the moment for anyone in any healthcare setting to have the legal right to a care supporter. And this is sometimes known as Gloria's Law and is something that our own witness, Jane Weir-Waboshka, mentioned when she gave evidence in week 1. So thank you very much for joining us today, Julia.
Oh, thank you, Nicola. Yes, I must say when Jane said what she said on it was the second day, wasn't it? Day 2. I thought to myself, yes, well, we can all pack up and go home. Now, I thought she expressed it absolutely beautifully. And when Baroness Hallett said, has it turned you into a campaigner? And she said yes. Although John's campaign had been running since 2014, certainly the experience of the pandemic turned us into a different type of campaigner. We used to think that things could be done by goodwill and voluntary action and positive campaigning. I'm afraid that those 2 years taught us that actually, Susan Hopkins said it in week 2, I think it was. She said, if you want to get something done, you need legislation. And she probably wouldn't agree with what we want to do, but we think if we want to get change, we need legislation.
I think that was a really, hi, Julie. It's so nice to see you again. We had you with us in module 3, and you said some things there. And it's even, you stressed how even existing legislation wasn't respected or observed during different things, the Equalities Act and the Mental Capacity Act and all that. And even, as you say, you need legislation, but even having legislation isn't enough, it seems. It's our staff aware of the legislation. It's all that kind of thing.
Exactly. Yes, I find it. I thought this week it was always very refreshing to have Caroline Abrahams. And this was on the topic of people's access to healthcare. And the lack of access, shocking lack of access to healthcare for people who are living in care homes. And she brought this into the field of human rights because yes, it is a human right. It's also a citizen's right. For all the people who are living in care homes now, have all paid in to the National Health Service. They're all part of our country, part of our democracy, and their human rights. And as you so rightly remember, all sorts of legislation, such as the Equality Act legislation, was simply thrown to the winds, I thought. And when Helen Waitley yesterday said, well, really, what does somebody need to provide leadership in a situation like this? I wanted to put my hand up at the back and say, well, observation of our current laws would be quite a good start.
Exactly. You mentioned Caroline Abrahams there. She testified on the 3rd day of week 3, and she was there on behalf of Age UK. We can talk about her and then maybe go back and talk about some of the earlier witnesses. As I know too well, she talked about the 19,000 deaths in care homes in the first couple of months, which is when my husband died, those awful months. And she talked about how older, as you've just mentioned, how older people's rights were breached. And she confirmed that it was a failure of government. She talked about one thing that struck me a lot about a senior clinician somewhere having to intervene when an older person who had an ordinary run-of-the-mill kind of respiratory problem, not a COVID problem, wasn't being admitted. A person who could have been treated relatively easily and wasn't admitted until this clinician intervened. And what I found kind of, I'm very happy for that person, but how many were not? How many people with standard complaints? Nicola, can I bring you in on this?
Yes, so Caroline talked about a letter that was sent by a GP practice to patients in Scotland. And it said, in regard to patients that get COVID-19, we would plan to continue to nurse our patients at home and not to transfer them to hospital. Sadly, if they are so unwell as to require breathing support from a ventilator, it is unlikely that given their frailty, they would survive. Now, this just transports us right back to module 3, where we were talking about the clinical frailty score. And we were told by everyone that this was completely wrong and that it was never rolled out and should never have been used. And yet Caroline Abrahams was saying that she was hearing about these things right across the UK. But what she said was, at least this practice, in a backwards way, at least they took the trouble to document it and put it in paper so that we have the evidence that it did happen. Because usually she's of the view that these things just weren't documented, because from the reports she was getting, it was a widespread practice, she said, from the evidence they got. So at least there is someone who was almost honest/stupid enough to put it in writing so that we have the evidence to prove that it did occur.
I think we got that from Wales as well, didn't we, this week, with Helena Herclot's evidence. And wasn't it Helena who came up with sort of a list of things, that if you get ill, you're not going to be offered a ventilator, you're not going to be taken to hospital. And as you say, Nicola, that this was all over the 4 countries of the United Kingdom, as if people living in care homes, whether they're older people, which obviously is Caroline Abraham's constituency and Helena Hercot's constituency, but also younger people, younger people with learning difficulty. As you say, it was a very strong message in module 3, but here we are hearing it, from the other direction, that somehow these people's lives don't appear to be valued equally to other people's lives. I mean, that was a really shocking one that came out of Wales, wasn't it?
There are so many examples of what you just talked about, Julia, that I'm sure we're going to come to. I wonder, if we go back to the first day of, I missed the very beginning, and Nicola, maybe you can tell me, Lady Hallett was remote this week. I just don't know what. Do you know why? I missed the reason.
No, so we were told during week 2 that the chair would be appearing remotely during week 3. There was no explanation given. She said it wasn't indicative of any regard she held for any of the witnesses. There was a slight joke with Vaughan Gething, who also appeared remotely, and she said, I think I was remote last time you were here, and please don't take it personally. But no, we weren't given any explanation as to why that was. She did say at the end of the hearing on Thursday that she would be back in person for week 4, so I'm not sure.
I was just curious. I have to say, I do think it's stronger when she's there in person, but that makes sense.
I still felt her presence quite strongly. I was only there for the day that Helen Waitley was giving evidence, but I still felt a tremendous urge to stand up and stand to attention when Lady Hallett's picture came on screen.
The first witness in week 3 was Dr. Jane Townsend, who was there on behalf of the Home Care Association. And I think the main thing I took away from her testimony was just her talking, and we've heard it in other modules as well, about how knowledge of social care was really weak in the Department of Health and Social Care. And how there were lots of new people. There was this turnover, this staff turnover. We've heard that complaint before. People couldn't really gain any expertise, and how she spent a lot of time educating uh, government. What I thought was interesting was she sort of praised Helen Whately. She said she was new, but that she understood health and she worked hard to get up to speed. She didn't mention Hancock, but yeah. Anyway, we'll come on to Helen Whately later, but I thought that was interesting. Julia, what did you heard her testimony?
Yes, I did. Yes. I mean, one of the things I think is good about, I have some criticisms about the current Module 6, or some disappointments, let's say, about the current Module 6. But I do think there has been some effort to cover domiciliary care properly. I thought, I think Jane Townsend is a very excellent advocate, together with Vic Rayner. They tend to come together and sit together, and they're managing this without lawyers. And what I think we're seeing is what an effort both those two people and their organizations put in to trying to get messages through in the, well, not just the early stages of the pandemic, but throughout pandemic. But really trying very hard. And I'm afraid how often their advice and their messages were disregarded. With Jane Townsend, I particularly thought that she was surprisingly good, or very eloquent and right on the isolation experienced by people at home. She was almost going beyond her brief, because I suppose her brief is to speak on behalf of domiciliary care workers. But actually, she was doing what we should all be doing, is looking hard at the people for whom these systems exist. And she was looking hard at the people, who were in their own homes, reliant on domiciliary care. And perhaps, with the care worker being the only person they might see during the day. And she put in a very eloquent plea for family access to supplement this. And I feel that this is such a strong thing that should never be an either you have family carer caring for you, or you have a professional carer caring for you. People, the same with care homes, either you have the care staff or you have a family carer coming in. There should always be this the recognition of the different strengths. And what she was saying, which I thought was really, really good, when she was talking about the isolation, was, wouldn't it have been just so sensible if a son or daughter, had been used also to dropping in during the day? Wouldn't it have been so sensible to have a sort of bubble system right from the beginning, which, in countries like New Zealand, family bubbles were formed right from the beginning. And then, that son or daughter would also be popping in during the day, as well as the care worker with their very limited time. And one thing she said, and I think I wrote it down, or did I write? I hope I wrote it down. Well, anyway, she said she was talking about the effect on people's well-being and their mental health, and she said something to the effect that the importance of mental health should be going right up the agenda. And that you wouldn't necessarily have expected somebody on behalf of domiciliary care workers to be speaking like that, but I thought she spoke excellently and quite rightly. And when you look at the deaths, because obviously you're part of the COVID bereaved families. If you look at the deaths at home and the way they spiked, and okay, so perhaps these were not all COVID deaths. The figures suggest that weren't, but there were so many deaths. Death is death, isn't it? Unnecessary excess spikes in death. I thought that what Jane Townsend was saying, which I think picked up a little bit on the last day with Helen Whately, was that the isolation experienced by people at home, and the way in which so many of their services were withdrawn, not least their access to community healthcare, could well have contributed significantly to those deaths.
Yeah, she I think the counsel for John's campaign was talked to her a lot about that and about mental health. I want to come to Nicola on it, but Nicola, I have a question. Our counsel, Anna Morris, asked about, well, she asked about remote assessments, but she talked about easements. And I'm not sure. And she said that apparently not Anna, I think the witness said she thought they hadn't been done legally. Can you, I'm not sure what easements are. Can you explain it?
Yeah, so Care Act easements was something that was introduced that would allow local authorities to essentially reduce the care package that was in place. Under the because they knew that care workers would be under pressure, and that there would be potential staff sickness, they thought the only way to manage it is if we reduce the amount of care that is provided to people. Now, these care packages are very carefully put together. It's not ideal to have, it's not the things we really would like to have, it's the need to have. So as soon as you start stripping any of those need to haves away, you really are, in my view, you're putting people's care at risk. It's moving it from safe care to potentially unsafe care. Depending on what you strip away, it's potentially on the bordering with neglect. And so this was a legal way of less care being provided. And I think what they said was that only 8 local authorities declared that they were making use of them. So they've used that as a way of saying, great, everyone coped, it was all fine. But what Dr. Townsend was saying was, no, 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 this is not the reassurance that you think it is. We just think that we think loads of people did it, they just didn't follow the formal process to do it. And that's what Anna was getting at with that question.
Yeah, there was also, it just broke my heart actually hearing about it because I think Anna Morris also asked about remote assessments. And the witness said that there was this incredible waiting list for an assessment. And all that time, if people couldn't get assessed, they had no care. I cannot imagine what life would have been like for some of those people. Did you have any other comments on this witness, Nicola?
Yeah, so there were 2 other takeaways from her. Care Act easements was the main takeaway. The second one was about PPE. Firstly, she said that their providers' business as usual orders that they were supposed to have coming to them were redirected to the NHS, so they were having to go without. The guidance was saying that there's unlikely to be community transmission, so they didn't need to use it. And she said, actually, nobody believed that guidance, particularly because the guidance on masks was inconsistent both in itself, but also with the local guidance. And then the other takeaway from her evidence was just about the general structure of the system. She says the way it's built allows people to pass the buck. So ministers will say, that's the responsibility of the local authority to do X, Y, or Z. But if you then go and talk to the local authority, they'll say, well, sorry, we can't deliver X, Y, and Z because central government doesn't give us enough money to do that. And so she said there isn't anybody taking proper accountability. And so it just makes it easy to ignore anyone who's crying out for help. And because it's always somebody else's fault. And I just thought, yes, that is the system that people are having to work with. And even before you put any pressure on it, the system itself is broken.
And I mean, Caroline Abrahams started her, very near the beginning of her statement, saying that already, and I think this is what you're saying, Nicola, that the criteria for getting any social care help at all is becoming more and more extreme. You know, you have to be sicker and sicker before you get anything. And going back to what you were picking up just then about the very unsatisfactory, stupid attitude to PPE, which was also testing as well, wasn't it? I mean, testing for domiciliary care workers. And of course, that made family carers additionally nervous if they thought that a care worker would be coming into their house without PPE, without any sort of testing. So, of course, it did quite often happen that families said, no, I'm sorry, we don't want this. We're turning down the care. And as you're saying, this wasn't just, optional, nice to have care. This was essential stuff. But the fear was so great and the lack of reassurance was so great that encouraged people to say, actually, no, thanks, but don't come anymore, because we can't trust. You've been out in the community. We all know that COVID is out in the community. There's no way you can reassure us by telling us you've just taken a test. There's no way you can reassure us by wearing proper protective equipment. We think it'd be safer if you didn't come in. And then they do without the care. And then the impact on the family carer is all the greater, not to mention the impact on the person who actually needed that care.
Shall we move on? I can say this, you can't, but I think the witnesses of week 3, we have what I call the good guys who are telling us what it was like on the ground, and then we have the villains. And I can say that. You don't have to say it, you don't have to agree with me. But we had Sir Sajid Javid, who was the former Secretary of State for Health and Social Care. And again, I don't know. They are always, in my view, so slippery. So I would like to come to you guys. He again did his usual thing about how the system was broken, even though they were in power for 12 years. The system is broken. And then his hopeful suggestion that people should look after their own relatives. I mean, I think that, I don't know, went around at the time as well. Julia, did you catch his testimony?
When I was looking back on my notebook, where I write down anything that I consider interesting that people have said, there's a great big blank. And let's not forget, we've also had Vaughan Gething this week. So, when we're talking about, slippery people. Back in the pandemic, I was so disappointed with Sajid Javid. I thought that I breathed a sigh of relief, and I can say what I like. I breathed a sigh of relief when Matt Hancock left. Sajid Javid looked like a caring and compassionate person. He's probably a nice guy, who knows? But he did absolutely nothing. And that was at the period when restrictions were being eased for so many people in the community, whereas people living in care homes were still, do you remember, still subject to those awful 14-day isolations, which you wouldn't stand for, repeated 14-day isolations, which you wouldn't stand for in a prison context. And I remember writing to him, when he came in fire, welcoming him and saying, and here are the voices of people. We'd just taken the government to judicial review about the refusal to allow people who are living in care homes to venture out of their care homes, which was a really shocking period. And, took trouble to sort of collect together a lot of people's voices, helpful evidence, people who are actually within the system and experiencing it, including the voices from some people actually living in care homes, just never even got an acknowledgement. And, sorry, that's probably digging up old bones, but I saw no reason to change my opinion this week. Sorry, I saw.
Yeah, I'm not surprised. I think one of the most shocking things, I was going to ask Nicola about this, that it appeared to me, I mean, that he was saying they considered not helping councils during COVID in order to avoid blame for central government. And he was pressed by council. Was that a legitimate concern? I mean, that maybe I've misunderstood that. Nicola, have I misunderstood that?
I am not sure why he was called to give evidence, to be honest. Everything he said, his explanation was either, well, that happened before my time, that was under Matt Hancock, or if it was during his tenure, he said, yeah, but there was a minister just for social care, so she would have dealt with it. So what he did whilst he was there, I've no idea. I found he was very, very blunt when we talked about the vaccine as a condition of deployment. And he basically just said, well, it's sad that people lost their jobs, but it was their choice. And he also wouldn't accept that care sector staff were treated differently to healthcare staff when it came to the vaccine being a condition of deployment. He just said, well, Omicron came in, so we didn't bother going ahead with it for healthcare staff. He was, I don't know why he was called. He added nothing. It just, we could have used that time to helpfully hear from someone else like Simon Stevens, who we know was the
Yes.
driving force behind the discharge policy. I think this was a real missed opportunity by the inquiry.
I agree with you. And that kept coming up again and again, this thing about not calling Simon Stevens when it comes to hospital discharge. It just seems, and you know, I'm not a pro, I'm just a bereaved person, but to me, it seems obvious that he would be an incredibly useful witness. And I think it was when our counsel, Anna Morris, was questioning him about hospital discharge that he dumped on Helen Whately, I guess, right? And oh, I found
And
him
even if it
odious.
wasn't, even if it's not Simon Stevens, that there is a yawning gap, which I hope that we might refer to in our closing submissions, because I see no reason to think that this gap, is being filled, because there is no one there speaking for the health service. I mean, and Helen Whately yesterday, came out with a really good question, which was looking at the GPs. Why didn't you go in? But there's nobody from the Royal College of GPs to answer that question. There's nobody from community healthcare. And if you think how the absence of, people like district nurses impacted on people in care homes, and the really horrific stories that we're hearing about the poor quality of end-of-life care. Now, if you're in a pandemic and the whole thing that is really scaring you is that lots of people are going to die, the one thing that you would thought you should do is ensure that if people are going to die, everything possible is done to assist them to die with dignity. And but there's no one. There's nobody from community healthcare. There's nobody from GPs. As you say, there's no NHS England representative. And I just feel if we looked back to Module 3, we would have been told, oh, don't worry, that's all going to be answered in Module 6. Well, it isn't. And there is a gap. And I feel that when we get to the end, unless something different happens, I feel that when we get to the end of this module, we need to put it on record that these questions were not answered.
I saw you nodding a lot there, Nicola. You agree, obviously.
I couldn't agree any more if I tried. The way the inquiry has run this in a modular format, it makes sense, okay? But most modules have a different legal team. And I keep saying this, the inquiry is mirroring the errors that were made by government during the time, by working in silos, by having groupthink, by, one team not talking to the other. And this is a perfect example of Module 3 wanting to touch on how healthcare impacted on the care sector, but being told that's not for this module. You get to deal with that during the care sector module. But now when we get to the care sector module, there's no one for us to put those questions to. And the number of times we've had witnesses say, well, I don't know why you're asking me. That's a question for Simon Stevens. Well, we're having to ask you because Simon Stevens isn't being called, despite us making numerous submissions to the inquiry that he should be called. It's really frustrating. And I'm afraid there's going to be a lot of questions that won't get answered because of this.
Can I just, you may have updated us on this last time we spoke, but is it absolutely the kibosh? He will not be called. Is that for sure now?
Absolutely definite. We made submissions when we first got the witness list. We obviously noticed it was a gap. We then made repeated submissions closer to the inquiry when you can really see that there's no one to put this witness to, but also you see how the evidence is shaping out, that his evidence becomes even more crucial because so many people are saying that the NHS, the head of the NHS were the driving force behind the discharge policy. And we were told he's already given evidence in a previous module and we have his statement. Well, in the previous module, we couldn't ask him questions about this because we would have been told that's for a later module. And fine, you've got his statement, but you can't question a statement. And I know we're jumping about a bit with the evidence, but Helen Whately on this was brilliant. Yeah, when she gave evidence, she said that she's sure that this policy was driven from the top of the NHS, and having read the statement of Simon Stevens, she was shocked at the lack of reflection by him on this very point. And it just really highlights the gap that's been left because of a decision by the inquiry.
And it makes those of us CPs, it makes a lot of us, I know, we lose heart when we see this. It like everything won't be heard, and it's very, very frustrating. You mentioned, Julia, you mentioned Von Gething. I just wondered if you
Oh no.
did you have more to say about him, Julia, Von Gething?
No, again, he's somebody I feel very difficult to read. And I feel so sorry for the people of Wales that they had such poor leadership. No, but one of the things that I did notice this week, and I think what was really what showed things up this week was once again the evidence of Helena Herclots. I was there for module 2B down in Wales, where she first started to speak out, and that was, you know, my first encounter with the Welsh establishment. I think the fact that the Welsh Older People's Commissioner felt it necessary to take the Welsh government, not exactly to court perhaps, but to task to report them to the Human Rights Commission for their lack of respect for older people's rights. I mean, that is a really staggering thing to do, isn't it? And there was so much of her evidence, and they were all very smart. I mean, they said, oh, of course, it was so useful to have her robust approach. They must have hated her at the time, because she was standing up and she was telling it how it was, and things like the Do Not Resuscitate scandal that was first broken in Wales, if I remember correctly, because of Helena Herclots, speaking out on that matter. But one of the things I noticed, and it was a comment, I think, from the council representing the bereaved family, the Cymru bereaved families, and what they just said it so neatly. There was a significant disconnect between what was promised to policy level and what was delivered on the ground. And I think we can see that in all 4 countries. And, this week we saw it in Wales, didn't we? The difference between all the fine words and all the fine promises and what actually people experienced, what families and care home residents and recipients of home care, what they actually experienced. And it was not fine words and the fine reports that were being delivered, were being written in high places.
Thank you for that, because that I wasn't able to hear her testimony. And Nicola, did you have anything to add about this witness?
Like Julia, I first came across Helena Herclots when she gave evidence in module 2B. We were refused CP status in that module, but I was following it because I thought it was so important. And she just struck me as an absolute powerhouse, someone who worked as hard as she could for the people she represented. We should be so lucky to have a commissioner like her in England.
Yes.
But what she said was, when she gave evidence this week, she said that they took the extraordinary step of referring the Welsh government for investigation to the Equality and Human Rights Commission. And in October 2020, they produced a report in response to this referral, and they had found that there may have been a failure in Wales to adequately protect life. Now, doesn't that just tell you everything? And skipping from her to Vaughan Gething, I never really know which Vaughan Gething is going to turn up. In some modules, we've had extremely defensive and combative and argumentative. The last couple of modules, he seemed to have been far more relaxed and jokey almost. He makes the occasional concession and talks in very logical language. But then when Council for COVID Bereaved Cymru questioned him, we saw him get a little bit more uncomfortable. And what was put to him was that the vaccinations in Wales commenced in December, but within 2 months they had only vaccinated 11,000 care home residents, but almost 300,000 people within Wales as a whole. And because of the prioritization that should have taken place, which meant that older people and people in care homes should have been prioritized, that clearly meant that care home residents had been leapfrogged by several other groups. And this was put to him to be, to have been an abrogation of his duty. And all he would say in response was, there were a range of factors beyond our control, but if you can't vaccinate residents in care homes, that doesn't mean you should not vaccinate other people. Well, what were the factors that were beyond your control? Why were you able to vaccinate almost 300,000 other people, but not get around all of the care home residents? That he didn't expand at all on what these factors were that were beyond their control, but that just seemed a very odd explanation or partial explanation to give.
I think there were some massive inefficiencies, weren't there? Sort of logistical inefficiencies in Wales. I think it was things like, they didn't have the right sort of fridges, to keep the vaccine in. We had known that the vaccine was coming. You would thought that there would have been plenty of time to roll out, sensible logistical plans. But clearly in Wales and, on this as in various other matters, they just couldn't get their act together.
And it just reinforces the belief, I'm sure, for the Welsh bereaved as for the bereaved here, just that our most vulnerable, our relatives, were not a priority.
No.
They didn't want to be, they didn't make the effort to do what it would take, whatever these inefficiencies were.
Mm.
We had another witness was Michelle Dyson, whose Department for Health and Social Care. She's still in post, right?
Lord knows
Yes.
how.
I mean, there was the one thing, again, we talk about this, people just batting it back and forth and blaming other people. And she was asked about COVID positive people coming into work. And she just said things like if they were short of staff, they needed to find alternative ways of safe staffing locally, as though this is something that can just be magicked up. And when she was asked about what, like us, or people who had people in care, and if it was considered low risk, then why were people not allowed visitors? And she just sort of said, "Oh, that's public health. That's a question for public health."
I think there are a lot of questions for public health, frankly.
I'm sure you're right.
And we've had, two heavyweight public health witnesses, who seem to me to have sort of, skimmed through without touching the sides. But again, it's this. And I think there've been several examples of this in week three, and people saying, well, so we'd rather have COVID positive people coming to work, because otherwise, it would be short staffed and it would be unsafe staffing. And yet, there are the family members, the essential, what were laughingly, what were correctly termed the essential caregivers, who could, in emergency situation, if you were in an actual war, I mean, Helen Whately sort of described us as being like the war. If you were in an actual war, you would look to see, right, I'm in a heck of a situation here. Who's going to help me out? And so if, you're in a situation where residents are being isolated, nobody's ever able to come in and look after them properly, you're short-staffed, you're considering having people coming from other care homes, which you're told you shouldn't do. You at that point sort of just look around and say, do you know what? I wonder whether if we asked, some of these family members to come in, they don't have to. It's not their duty. And we're not saying that a family member and a paid care worker is the same person, is the same, job. But on this occasion, when people are deteriorating through loneliness, through isolation, they're deconditioning, they're not going to get their faculties back. And we're saying, well, we're sorry, we're so busy, or we're sorry, we're so busy, we can't even facilitate visits. Don't you look round the other way round and say, I wonder whether there isn't a safe alternative here, and that is an essential caregiver coming from his or her own home directly just to one person, not going from person to person, not going from home to home. You're not saying that, I'm not saying that this is any replacement for care workers, because of course we should have both. If you're in a situation like that, if you have a choice of, we either have COVID positive workers coming in, or workers coming in who are going around many other, they're in the community, they're going to other care, and then we're still having them in, we're probably not even bothering to test them properly. And all the time we have loving spouses, loving daughters, dearest friends who would willingly self-isolate, keep themselves safe, and just come in to help the person who they love. I mean, it's as if there was something, I don't know, sort of really spooky about family members, as if we were seen as uniquely dangerous creatures. God knows why. We're just people like anybody else, and people who care the most about not bringing any infections in. And people were suffering in isolation and deteriorating, and I would say dying, just because there couldn't be, there couldn't be the sort of relaxation. And after all, one of the reasons why they were so flipping short-staffed was because pre-pandemic there had been family members coming in regularly. So by saying, no visitors, visitors, that word annoys me. By saying no visitors, they were actually depriving themselves, of a significant percentage of their unpaid staff. I mean, somebody like me, I used to go in twice a day to my mother. And this was pre-pandemic. I went in every morning to give her breakfast and help her take her medication. I went in every evening to put her to bed. Now, ban me because I'm just a family member, and that's actually extra work for the staff. There's no really logical thinking going on here.
You're 100% right, and I agree. That was my lived experience. I think staff pre-pandemic welcome family visitors. We were often good at calming our loved ones. We were as well as looking after their physical care. And I know the burdens were tremendous in my husband's care home on the staff once we were forbidden to go.
Yes.
I want to come to Nicola on this witness, but Nicola, there was one extraordinary exchange with our counsel, Anna Morris. Again, she talked, and I hope you're going to talk about this. She talked about this communication about a scary narrative on March 11th, suggesting that perhaps the care sector, was kept in the dark so that they wouldn't be risk averse to discharge from hospitals. I think that's how I read it anyway. That's how I interpreted it. So, Nicola, what were your thoughts about Michelle Dyson?
The first thing to say about Michelle Dyson is, once again, the inquiry has called the wrong person, because her predecessor was Ros Rawton.
Yes.
And we see her name pop up time and again in all the emails. She's all over everything, yet she hasn't been called. Now, we don't know what happened to her. All we know is she stepped down in July 2020 and took a career break. But that means she was in post when all those early decisions about hospital discharge were being made. And yet we don't have her perspective. And you can see that there are emails about having to handle Helen Whately. Basically, she's the Minister for Social Care that needs to be handled. That's the person that we needed to hear from, not her successor, who has conducted, according to her, a review of all the material and is then giving us her interpretation of what was meant. The entire thing is just, again, I'm afraid, another missed opportunity. The one thing I really did want to pick up on was a different exchange between our counsel, Anna Morris, and her. And this was a reference to in January 2021, this witness highlighted 6 cases of staff who were known to be working whilst they were COVID positive. And we pointed out that it may have been 6 cases at that point, but it then increased to 50 cases. And then by April, it was 94. And Anna was basically putting that this was indicative of a failure of the UK government to grip the workforce issues and shortages. And of course, the problems with pay that meant that people would have to go into work. And her answer to this was so extraordinary. She said, I mean, we are talking about 94 staff out of 1.2 million. So I do think we need to keep it in perspective. And I mean, as we've discovered, there were problems in the workforce. So firstly, it sounds like she's blaming the workforce rather than accepting there were issues with inadequate or insufficient PPE or insufficient pay to allow staff to take the time off that they needed to isolate. And secondly, the suggestion that this is just 94 cases completely misses the point of how many residents those 94 staff might have infected. And this is despicable. And once again, we see them changing the narrative to suit them, switching between claiming that the hospital discharge wasn't the main route of transmission, it was staff, to then say, well, it was only this number of staff, we need to keep it in perspective. So whatever statistics are, they just get thrown around and they spin it to suit them. And it's despicable. And she shouldn't have been allowed to get away with saying that. And unfortunately, because of the way we have to submit our questions in advance, there's no ability to come back in the way you would do in a normal court process. But I'm very angry about her evidence and the lack of her predecessor being called as well.
I agree, because when I heard the name of her predecessor bandied about, and the chair praised her at the end for having reviewed previous stuff, and what you just said about how many did those 94 in fact, and this is the thing about our dead are not numbers. It's like treating them like statistics, and you know, oh, how many, a small number would have been infected and died, and it's horrible and disrespectful to hear our bereaved talked about this way.
Yes, sorry, Lorelei, but even if there had only been one care worker knowingly coming to work whilst COVID positive, that is unacceptable. It doesn't care whether it's 6 or whether it's 30 or whether it's 94. Even one care worker coming to work in a place like that is unacceptable. And if it's because of the structural reasons for that worker needing or making that decision come to work, and for the manager, because you know we did hear, didn't we, stories of management who were reluctant to have testing for their staff because they didn't want infections to be shown up. The fact that it's structured in such a way that that sort of thing is even, I'm not going to use the word acceptable, but that sort of thing happens, and that perhaps, you know, a low-paid worker says, actually, I'm going to lie about the result of my test because I need to come to work because there's no provision for me to wait. That's what Nicola's saying. The the responsibility is with them, and the words like police were used, but the bigger responsibility is with the people who knowingly allow that system to be like that. And there's been so many people who've started their evidence saying, oh well, yeah, sorry, broken system, such a shame, badly set up. Well, do something about it then. And when Jane Townsend was talking about domiciliary care workers, she said, let's just remember that in our sector, workers are paid by the minute. I mean, how awful is that? It's supposed to be a first world country, I think.
Yeah, yeah. We've already talked about this witness quite a bit, Helen Whately, but shall we move on to her? I found she was really interesting because she was really angry at a lot of people. And of course, over this module and other modules, people have been a little bit like throwing her under the bus. And at one point, I think Counsel for the Inquiry had to say, I'm sure this is important to you. I think she was angry about something, but it wasn't relevant to the evidence. One thing that really shocked me that came out kind of early in her evidence was when she said it had to do with the discharge policy, but she said ambulances were just like dropping people off at care homes. That's the first time I'd heard something like that. I wondered, Nicola, I'm sorry, or Julia.
No. I think that has been heard. I think that's come up in various care home managers' evidence. That they did feel, some of them, very disempowered, and that yes, people just arrived and were, as it were, dropped off. And I think Helen Whately was saying that she had heard this, and I think it is to her credit that she listened to people like Vic Rayner and Jane Townsend to some extent. I'm not letting her off the hook, actually, but she did do her best within her limitations to find out what was actually happening. And yes, that was actually happening. And you're right, Lorelei, she was angry, wasn't she?
Yeah, my heart went out to her a little bit, because even just some of the exchanges, like of her virtually begging for PPE, for social care, and all that kind of a thing. Um, I, our counsel, Anna Morris, I loved her point. It's something she said, and then I'll come to Nicola just for generally about this witness. But I loved Anna Morris's point, saying that Helen Whately at some point had said the discharge policy was a great success. And Anna said something like, I think the bereaved would measure success by saved lives, not bed capacity. And this reminded me of something that you said in the last time you were with us on this podcast, Julia. You quoted someone saying, we weren't there to save the NHS. We were there to save individual lives. And I think it's that the focus for us seems to be quite different to the focus for government. So having said that, Nicola, what did you make of Helen Whately's day long? It was quite a long day for her.
Yeah, she was on the stand for a full day. And I've previously kind of had a go at her on some of these podcasts. I've always found her to be less defensive than some of the other ministers. But there was a particular exchange where she was asked about the minutes of a meeting by our counsel, Pete Weatherby. And I just found her answer on that occasion implausible. But I have to say, on this occasion, maybe it's after watching other people throw her under the bus that she decided, I'm not protecting you guys any longer. She came after Jenny Harries. She came after Simon Stevens. I think her testimony was difficult, but very, very important. So first of all, with Jenny Harries, she was talking about how on the 5th of March, there was this meeting where Helen was fairly new to the role, and she'd been trying to get to grips with whose responsibilities were what. And then she was like, okay, so the local authorities, they need to have plans for a pandemic. And she said Jenny Harries said that there were hugely detailed plans at a local level, but they may not be on the surface. And in answer to this, she said, I'm intrigued Jenny Harries saying that there were hugely detailed plans because I never saw them. And she said, if you ask for something and nobody will give it to you, the most obvious conclusion to reach is that it doesn't exist. Because we know that she'd been asking and asking and asking for the local authority plans, and in the end, she only got 2, and both were completely inadequate. So I've gone back and checked Jenny Harries' evidence about this line in the minutes of the meeting. And she claims that the reference to the hugely detailed plans was a reference to plans held by individual care providers rather than the local authorities. And when she was asked if she'd seen any of the plans, she kind of scoffed and made out as though that was beneath her, and well, that wouldn't be my job to do that. And then when she was asked with how she would have assured herself that the plans were adequate, she said, well, it was for the minister to be assured, not me. Yet here we have, in a meeting, assuring that minister that the plans are not only adequate, but are very, very detailed. And once again, she's walked away without any consequences. It blows my mind, quite frankly. What was apparent from the evidence of Helen Whately was the scenes that she saw happening in Spain and Italy, and she referred a number of times to care homes where the workers all left and the residents were abandoned. That does seem to have truly haunted her, and that seems to have been what was driving her at every point to make sure that didn't happen. She wasn't consulted on the discharge policy. When she became aware of it after the fact and people are raising issues with her about it, she then kind of forces her way in and basically says, you know, the Minister for Social Care should have been consulted on this issue that touches on social care. But then she's given assurance that care homes will be able to isolate safely. That's the clinical guidance that she's given, but also that the care homes will be able to choose whether or not to accept a hospital discharge. And then again, she starts to get all these stories that isn't what's happening on the ground, that there are these people being pressured into accepting residents that they don't feel they can look after safely. And she picks up on this point that she said, I have a frustration with the NHS in that they appear to take a view that care homes were there to serve the NHS. And she made the point later on that the NHS was concerned with the NHS, wasn't concerned with anything else. And it comes back to that point. It was not about saving the NHS. It should have been about saving lives. And this is when she made the point about she thinks the discharge policy was driven from the top of the NHS. And she says, I've read Simon Stevens' submission to the inquiry. I'm surprised he doesn't reflect on his role in this policy because people who worked for him were pushing very hard for the discharge. So again, why wasn't he called? Her evidence was striking on a number of issues. And she said this, one of the conundrums for me is in the second wave, after we had the winter plan, we've got sufficient PPE going out to care homes. There's training in place on how to use it effectively. We've got large amounts of testing going on. We've got designated settings for anyone who is infected. Despite all of that, COVID was still getting into care homes. How? Why? And she said her only conclusion to that is the PPE mustn't be working.
I noticed Baronet having nodding at that point, didn't you? Yes, because she's talking about the poor quality and the evidence of relatives. I mean, it's horrible. But when somebody had died, the funeral directors would arrive in sort of full sort of hazmat gear, and you know to you know, do their jobs. But yet the staff who had been in there, who had been, caring for that person in their life, would have, a flimsy little apron and one of those silly blue surgical masks. And I think I noticed Baroness Hallett sort of really nodding, because if you remember in module 3, they really went to town on the need for people to have properly fitting, what are they called, FFP3 masks, and ones that fit you if you're a woman or if you're from an ethnic minority, or you just have a different shaped face, a properly fitting mask. Now, over 2 years of a pandemic, you would like to think that the staff, the regular staff working in care homes, could also have been considered in that way, to have properly fitting masks, if it was felt to be important, and clearly it wasn't. Because there was another point that came out, that, and I think this must have been Helen Whately again. Did she just? I can't remember. It was making an analogy with a hospital, that in hospitals, the highest rates of infection of people caring on ordinary wards for ordinary patients, rather than where they only had this lower grade of personal protective equipment, rather than in the intensive care units, when of course eventually hazmats and visors and all those things were available. And again, we often talk as if the pandemic was only those first 3 months. It wasn't. It was 2 years. There was time to fix things, and they didn't get fixed.
You're 100% right. And talking back to your story about care homes, that happened, and this was at the beginning of the March 2020. Funeral directors came to get my husband in hazmat suits. They knew early on, while the people looking after him had some bin liners and dinner lady aprons, as you say. It was horrific.
I'm sorry. Yes.
Thank you. I mean, I'm just pointing out, it is like some people were aware. I think it's about that time when I like to ask everyone if they have a standout moment, good or bad, from the testimony. I'll start with mine, which was Javid. It was when the counselor for John's campaign asked him, could you have done more? Should more have been done to listen to vulnerable people? Could you have done more? And he said, could I have done more? I don't see how. This tells me everything I need to know about him, about that government. There is no humanity. There is no humility. What I will say is, could he not have done more, then he wasn't up to the job, because he failed as far as I'm concerned. If he did truly pull out all the stops within his limitations, he could have showed a little humility. Someone could have said, I only wish I could have done more. There was no acknowledgement. Could I have done more? No. I give myself A+. That was my standout moment for bad. Did you have one, Julia?
Oh, that's a really hard question, Lorelei. I did have a standout moment. It was when Helena Herklotz said that people who are living in care homes don't just need the same rights as people living in the community. They need better rights. They need better care. They're in care homes for a reason. They're very often very ill. At the end of their life, they should have had everything they wanted. Not have everything taken away from them. So that's my standout moment. It's let's give people in care home extra rights, extra comfort, because of the situation they're in. That's what I'd like.
I agree with everything you say, and I'm just so pleased about your campaign, because I think I will call it torture. The torture of such vulnerable people in care homes that went on is unforgivable, and I hope, if anything comes out of this inquiry, that is one of the things that is addressed, that this kind of
So.
inhuman treatment doesn't happen again. Nicola, what was your standout moment?
So it's a moment that you referred to earlier, and it's when our counsel Anna Morris questioned Helen Whately about her stating at a meeting in April that the discharge policy had been a success, and Anna essentially asked her, what's your measure of success? And her answer was really interesting, actually. She said that she was attending the meeting on behalf of the Department of Health and Social Care as a whole. She wasn't there in the capacity as just the social care minister. She says, looking at it as a former social care minister, she has a very different perspective on it. And this, she said, I have a concern that it was one of the sources of infection into care home at that stage, and in any event, put care homes in a very difficult position where they felt they were required, made to admit people discharged from hospital, and they were very worried about doing so. So that gives it a less good verdict as a policy, shall we say. And then she went on to say this. The rates of excess deaths started to increase in care homes in mid-March, implying that you were beginning to see COVID deaths at that time, even though there wasn't testing to prove it. There is a gap in the work that could and should have been done to look into the impact of that policy. Yes. Yes, there is.
Yes, yes. Well
Yeah.
said.
I think we all agree with that. Julia, it's so lovely to see you again, and thank you so much for joining us. And Nicola, as always, thank you for your, making things so clear for us. I really appreciate it.
No, thank you, Lorelei, and thank you, Nicola. I've been able to get a few things off my chest.
Thank you very much for your time, Julia. It's been
Okay.
a pleasure having you.
Lovely. Right. Bye-bye then.
Thank you.
Thank you.
Thanks for listening to this instalment of the COVID Inquiry podcast. We hope you found it insightful and interesting. If you did, please rate us on the podcast platform you use and share the pod with friends and family who may value this type of commentary. We're looking forward to you joining us next week for more expert commentary, opinion, and insight into the COVID Inquiry evidential hearings.